I'm speaking today with Dr. Majola Omolu. Dr. Omolu, Vaccinate for the Culture is a Toronto-based grassroots community collaboration with the Jamaican Canadian Association that is promoting the importance of COVID-19 vaccination for the Black community. Why is it so important for the Black community to be vaccinated?
That have been negatively affected by COVID. Us and the South Asian community have been the hardest hit community in terms of in terms of the consequences and getting COVID. Part of that is due to socioeconomic, and part of that is also just due to the way our system is set up in terms of the jobs that we're doing. We tend to be, make up a good bulk of frontline workers. So we've been negatively impacted by COVID more than any population. And currently, when you look at the data, we have a lower rate of uptake of vaccinations than our Caucasian and Asian counterparts. And I do think it's important because we need to protect ourselves and be able to build our community and build our family by not getting COVID and not getting sick. And I think people always think, well, I won't die from it, but the symptoms of long COVID could be very debilitating, and for some people, lead to chronic illness.
Okay, that's a really important point that you mentioned in terms of long COVID that a lot of people don't consider. So the COVID-19 pandemic has exposed health inequities in Canada. So how has racism contributed to this disproportionate impact on the Black community?
I would say that part of it, I'm not sure how much of it is racism as much as when you look at resource allocations and you look at just the way the medical system is set up, like this is systemically and institutionally, it is anti-Black and anti-Indigenous. And so the COVID-19 itself is not, because people are always like, well, why you guys, Black people are always claiming everything is racist. And, the COVID-19 doesn't know that, you're Black or you're this. But what it does know is that when you live in certain types of housing where there's less space, when you have to be working, it does expose that. So I would say in terms of when we talk about medical racism, in terms of COVID, it's more of the social determinants of health than actual when you seek help for COVID-19, if you get COVID-19, if that makes sense.
Absolutely. And thank you for bringing up about social determinants of health so that people will understand that connection between access to care and being more susceptible to illness. So Vaccinate for the Culture campaign is encouraging COVID-19 vaccination as a measure to promote Black health, Black lives, Black love, Black joy, Black culture. Can you speak to this message? How does it resonate with you?
Oh, I think it's important. I think Black joy. I am a fairly new mom of a 1-year-old. And for me, I'm raising my child I don't love like when people say resilience. I don't want him to be resilient. I want him to have joy. I want him to live in a world where he sees everyone around him healthy and happy and not struggling. And I think that it's important to understand that, we do have a great degree of hesitancy in the Black community, but with the right education and we get vaccinated, we can protect ourselves and continue to build upon generations. Like when you look at the States, generations of families are wiped out from COVID-19. We cannot take that kind of assault on the Black family with the institutions that we have stacked against us. So we can make a choice to celebrate ourselves, to celebrate joy, to celebrate life by getting the vaccine and protecting ourselves. Yes, it won't necessarily keep you from not getting COVID-19, but it will prevent you from having been hospitalized, which means loss of income for your family. And if you don't have any benefit, like I don't have any benefits, so if I don't work, I don't get paid. And there are a lot of people who are in the same position as me. And so, yes, you might not end up dying, but you'll be losing income, which directly affects your family. And yeah, that's the main point. And as I mentioned before, the chronic illness, which is another, trauma that puts on our family, where we already have higher rates of hypertension, diabetes, and mental health, because and those are parts of that is also because of anti-Black racism. And so we should do everything in our power to take away anything that will steal our joy and our peace.
That's a beautiful answer. Thank you so much for that. So I'm wondering, in your clinical practice, do you encounter patients that are reluctant to get vaccinated? And if so, what do you tell them?
I do. And I also, because I am a co-lead of the vaccine clinic at Taibu, that is a main part of my job, is talking to people who are folks who are hesitant. And I think it depends on, each person is individualized. And I think that we're not a monolith, the Black community, nor are people or not to get it.
Well, thank you so much for that answer. And also for participating in this brief interview, which again, so just to let everybody know that we are listening today to Dr. Omole, and we want to thank you so much for your contribution to this project. Again, have a wonderful day.
Thank you so much for having me. You too, you take care.
Okay, bye-bye.
Bye.